On a 30-minute walk right before I start to see my first patient. Got in really, really early to be able to finish notes. Still got about 8 patient calls to answer, but I've done about 30 or 40 of them and needed a mental break and wanted to make sure that I at least, if I don't work out, which I do plan on working out, get at least a 30-minute walk a few times whenever I can to kind of change the scenery a little bit because it was becoming a little bit depressing just because it's been just doing probably anywhere between 20 and 25 notes that I've done over the past few hours and haven't really been able to just work out. So I use this opportunity to be able to remind people to get your exercise on, get your walk on. So um, I'll just keep on walking until I reach 15 minutes and then turn back around. Hopefully that should be about 30 minutes back and forward, and then probably a little bit of what I do to prepare for my first patient. I think my first one is actually either a brand new patient or a hospital patient. One of the good things about that is that I allot myself a 30-minute slot to be able to see them at an adequate time. For the person who just came on, let me know if you can hear me okay. My name is Dr. Isang and I'm a cardiologist, and I use this platform to discuss the importance of health and prevention, but also now incorporating doing things like just showing a day in the life of a cardiologist, some of the things I do to maintain good shape if I don't have time or if I'm crunched for time. So it's just finding moments where you can exercise is going to be the most important thing. If you think about it, like the muscles that you have down are only going to get weaker if you don't use it. So I try really hard to incorporate walking on a daily basis because I want to be able to walk in my 70s, 80s, and even 90s. I don't know if you guys have seen some patients who are in older age and they have to use a cane, or they struggle. But then you've seen someone else with the same age and they are physically fit, and I think a lot of it is because they continue to walk for a long period of time. And my mother and father are prime examples. My father walks a little bit more than my mom, anywhere from 3 to 5 miles on a daily basis, versus my mom does like 1 to 2 miles. My dad is significantly older than my mom, but when I see him get up and move, he moves a lot faster. So one of those things, if you don't use it, you will lose it. So getting my walk on. If you guys can hear me, let me know too. I want to make sure. I don't know why I have this headpiece on, but I think it's also good to have this headpiece on, so when people walk past me, it makes it look like I'm talking on the phone, which I am. But man, give you guys a little bit of a scenery of where I'm walking and a little bit of history. So like I said, my name is Dr. Isang. I am a cardiologist, so it took me a dang long time to get to where I am right now, and I'm freaking proud of myself. And sometimes I need to tell myself that more and more, because when you are silent, sometimes your mind will play tricks on you. Sometimes your mind will say negative things to yourself that you don't deserve what you have. You don't deserve the achievements that you've accomplished, and I do deserve it. So as a cardiologist, how did I get here? We have 4 years of undergrad. We have 4 years of medical school. We have 3 years of internal medicine residency training, and then another 3 years of cardiology training. So a total of 14 years to become a general cardiologist, which is what I am. If you want, you can also pursue interventional cardiology, heart failure, electrophysiology. There's a lot of different aspects of heart failure that you can accomplish. I mean, of cardiology you can accomplish, which is an extra 1 to sometimes 2 or even 3 years of training after my 14 years, I stopped at general cardiology because I really do like general cardiology, inpatient, outpatient, some procedures, EKGs, echoes. So I really enjoy it, and I'm not gonna add more to it, my specialty, if it's not going to increase my job satisfaction, but also quality of life, as my wife is an OBGYN and we have 2 kids. One of the most important things I want to do is not to repeat traumas, because my mother's a psychiatrist, and I remember early in her career so busy with work and wasn't able to make it to all of the games or events. So I want to be able to do that for my kids. So that's my spiel. Beckham, what is going on? If you can hear me, let me know. Make sure that I'm not talking to nothing. Usually my pace when I'm walking is usually a 26 to 27 minute walking pace for a mile. And right now I'm at 24. So walking a little bit faster than I normally do walk, but it's all right. Well, when it comes to cardiology, most importantly when it comes to your health, I think one of the things that I always say is prevention is a lot better than treatment. So what does that look like, or what does that mean? It means that if you understand what the risk factors for heart disease are, it's better to prevent it than to have to treat it, because a lot of times people will ask me, how can I reverse something from happening, or that has happened? And a lot of times you can't reverse it. You can try your best to get back to how you were, but not everybody's always successful. I've seen some amazing stories of someone having a massive heart attack and then their heart function went back to normal. But I've seen more cases where it doesn't go back to normal, or even worse cases where it stays pretty bad. So if you can understand that treating your blood pressure now can prevent that heart attack from happening, that's a way better option and choice option. When it comes to do I want to take this route? This one is a quarter of a mile. No. Just because I think I know how far I have to walk to make it to half a mile. And I'm pretty much there, so usually the same spot. One thing I can say, these walks are a lot easier when the weather is not so dang cold. So the question is, are diabetics at more risk of heart disease? And the answer is yes, unfortunately, especially poorly controlled diabetes. Not just heart disease, but can lead to strokes, can lead to peripheral arterial disease, which are arterial blockages in the legs, and carotid artery disease, blockage in the carotids, which can also lead to strokes. So having that A1C well controlled is one of the biggest things. Diabetes and combination of diabetes and high blood pressure are the leading causes of kidney disease, specifically end-stage kidney disease, where you need to be on dialysis, or to be on a transplant list. So, short answer is yes, diabetes is a significant risk factor for heart disease. Hey, good morning. In addition to diabetes, you have to also look at insulin resistance. So, and that's from, nutrition. The more carbohydrates you take in, the more your body, or sugars, the more your body will produce insulin to get rid of it, which is good, but also bad because your body becomes resistant to it, but also the multiple bouts of insulin spikes can lead to resistance. This is usually when I turn around, when I've hit the half a mile, but I'm gonna walk a little bit more to get to 15 minutes and turn around. But yes, insulin spikes can also lead to atherosclerosis, which is plaque buildup, and subsequent heart disease, heart attacks. Hey, good morning. Walked past 3 people so far, and the one thing they all have in common that I don't, is I didn't bring my gloves, and that's the one thing that I'm struggling with right now. So it's not bringing my glove. That one's, But as I walk, if you guys have any questions, just leave it in the comments and I'll try my best to answer it regarding the heart, regarding your health, and regarding prevention. Cold, cold, cold. Alexandra, what is going on? You want to be a doctor. What type of doctor do you want to be? Where are you coming from? About 2 more minutes and then I'll turn around for the other 15-minute walk. Gastroenterology, so a stomach doctor, a GI doctor. What that entails is, of course, 4 years of medical school, 3 years of internal medicine residency, where you'll be trained in a little bit of everything, including, GI, pulmonary, cardiac, endocrine, rheumatology, and then if you should want, then you would do an additional 3 years of GI fellowship. So that's also 14 years total, including undergrad. And I think with GI, there's a 1-year subspecialty. Not many people go into it, where they do some more invasive procedures. But not many people do that. But it's about 14 years, including undergrad, to become a GI doctor. Where are you at in your process of wanting to be a gastroenterologist? Is it high school? Is it college? Is it post-college? That in-between section, or medical school? Yeah, I can turn around because I'm actually gonna walk to my car to get my Apple Watch charger. So that's an extra 1 to 2 minutes. Also, Alexandra, does the audio sound okay with this too? Just wanted to make sure that people are hearing me clearly. All right. This is my amazing grace. Man, such a nice little walk. Just cold AF, but ooh, that's cold. All right, welcome. Those of you guys coming in, let me know if you can hear me and where you're coming in from. I'm Dr. Isang, heart doctor, going on a 30-minute walk before I see my first patient. And also, if you guys don't mind, if there's any topics that you guys want me to like make videos on, let me know in the comments and I'll do my best. And I think I made a poll about it, and I think the majority wanted to do a topic on secondary hypertension. So this is high blood pressure that's due to something else. So I'm going to be making a video on that coming soon, maybe even today. Oh man. Color, 20 in blade, on the Impala color. So when it comes to exercise, one of the biggest recommendations is usually 30 to 50 minutes, anywhere from 3 to 5 times a week. I think what's more important is consistency. So if that's too much to allocate, but you can definitely do something like 15 to 20 minutes, heck, even 10 to 15 minutes, which if you can do that consistently every single day and watching what you're eating, not striving for perfection, just improvements, man, like you will see your body change in ways that you wouldn't even imagine. I think one of the best times fitness-wise for me was when I think I was allocating anywhere from 15 to 30 minutes. I tried not to go above 30. I think I went above 30 a few, and that's when I could jump rope. Right now I can't because of some foot pain I'm probably 2 months away from being able to jump rope again, but when I was jump roping basically 4 to 6 times a week, I was only utilizing 15 to 20 minutes and I was in really, really good shape. So that just speaks. But I also was watching significantly what I was putting into my body and how often I was eating too. So that plays a huge role in your physical fitness. Is monitoring your nutrition not just plays a huge role, that is the biggest factor. So consistency. I mean, I've had my patients and I've had personal friends that have lost I think one lost 60 to 80 pounds with just nutrition. So it's definitely doable. It gets harder and harder, but it also gets easier the more you implement it. The first day is extremely hard. The first week is extremely hard. Second week, a little bit easier. And then once you do it consistently, oh my goodness. Sometimes I understand when people say the weight melts off because I've experienced that. And it actually scared me because I was losing weight too much, too fast. But that was 6 to 8 years ago, and I was working out like a maniac, actually. Now I'm doing a good 2 to 4 days a week. 2 days really, really hard, and the other 2 days mild to moderate. I don't really go hard as much anymore. So most days are typically mild. Most days are typically moderate. 24-minute mile. You guys got me walking faster than nah, it's not you guys, it's the weather. It's cold, so I'm trying to get back into the office. Perfect. It's gonna be a better way. Let me know if you guys have any questions. It's gonna be a better way. Before I hop off, I'm gonna switch to interview mode. If I can get this off. Alright, if you guys can hear me. Perfect. So, one of the biggest things that I see people for is heart disease. And one of the biggest risk factors for heart disease is not just blood pressure, but uncontrolled blood pressure. A lot of things come with that too. You can think about obesity, you can think about genetics, you can think about nutrition, but what is considered high blood pressure is when the top number is greater than 120. Do we automatically use medications for that? Not necessarily. But if it's over 140, definitely 120 to 140, lifestyle changes with nutrition, exercise, stress management, and looking for other causes. This is sometimes known as secondary hypertension. So high blood pressure that is due to something else, whether it's your thyroid, sleep apnea, your kidneys, your adrenals. And the only way that you can know if you do have secondary hypertension is by seeing your medical provider and getting the lab workup. I've had a couple of patients that I've seen, not just for high blood pressure, but for palpitations, and they end up having issues with their thyroid as the cause of it. Not enough to know that it needs to be worked up appropriately, because every now and then, instead of putting someone on hey, good morning. Instead of putting somebody on medications for their blood pressure, the answer may be treating their thyroid. The answer may be treating their sleep apnea. The answer may be looking at how much their salt content intake is, or what type of lifestyle they're living, if they're sedentary, the foods that they're eating, the stress that they're in. Of course, that is also if their blood pressure is not, in the 150s, 160s, because you want to do that, but also treat it. Blood pressures in the 150s and 160s are risk for strokes, heart attacks. So you can do a mix of everything, but you gotta have the concern that something else may be causing the blood pressure to be elevated. And that's my spiel. And if anybody has any questions within the next 2 minutes, let me know. If not, I'll be off. Actually, no, I won't be off. I'll probably be in the office and getting ready for my first patient. I gotta move this around. All right, I think that's a little bit better. First things first, do I have my keys? I do. All right. Let me know what you guys' questions and comments are. If not, I'll be silent too. Make sure I have a thicker jacket. All right, we're at 30-minute mark. Oh goodness, my hands are frozen. All right, for anyone who's joining in, the 30-minute walk is basically done. Now I'm going to be getting ready for my first patient. Y'all are going to disappear for like 30 seconds, maybe 45 seconds, and then reappear back in my office. If you guys have any questions regarding cardiology, day in the life of a cardiologist, what I like the most, what I don't like, or what I don't like. Morning, morning. Whew. All right, that was last seconds. If you guys can hear me better, let me know too. Fingers are frozen. When I walked in, I think I saw a few patients that are my patients that are already here, which is good. They came early, came on time, so early to, what is it, early to bed, early to rise, makes a man rich, wealthy, and wise. First things first, I want to make sure that people can hear me okay. That would suck if this whole time nobody could hear me. Testing 1, 2. All right, yeah. So right now I'm getting ready for the patients that are going to be coming in to see me. Um, one of them is brand new to the office, but I've seen in the hospital, and the other ones, 6 are new. No, are follow-ups. That was weird. Starting to feel my hands again, so I'm not taking this one. I just wanted to be kind of chill. Or this patient that I saw had an ultrasound of the heart and it was normal. Just trying to see what prompted. Looks like so far I'm not finding anything that needs cardiology. Maybe they had a stroke and they want to rule out. Hmm. Had some plaque in the heart arteries, but very mild. So more than likely they may have gone to a different hospital after. Hmm. Yeah, so far nothing that I've found, and it's typically good, and they could office visit to kind of start from scratch and see what could have prompted the cardiology consultation. And an office visit with your medical provider, high blood pressure. Hmm. Well, it'll be a good one. All right, welcome anyone. I just finished my walk, so for those of you guys walking in, coming, finished the 30-minute walk, so now I'm just preparing for my patient. Kind of starting a poll to see if what the consensus is regarding people's blood pressures. Yes, period, cardiac, we will see. Yes, period, we will see. It does not need CT scan. Period. I can't think of a reason at that time. Period. Only options would be increasing the metoprolol to a full tablet twice a day to see if this will help with her heart rate. Period. Was she able to get the evaporating question mark? one more minute. If anybody has any questions, let me know. Or not, unless I'll see you guys at the next video. Next one most likely is going to be a workout video. So mostly me just working out. So let me know if you guys have any questions. Four hundred. I'll go to 400. All right. I'll talk to you guys later. You guys have a good one.